as the basis for evaluating the patient's response to the treatment. Next is assess patient's ability to assist in the bathing process as well as the personal hygiene preference. Also remind the patient to ask for assistance whenever she's getting up. Next is assess if patient has any medical device or equipment on her. So as you can see, my patient here has no any medical device or equipment on her. And after that, assess the patient's temperature, body temperature. For planning, bring the necessary equipment to the bedside stand or table. Bath should be administered for at least 30 minutes to be effective. And constant monitoring of the patient's body temperature is essential so that it does not drop below the normal. Also, maintain the level of privacy throughout the procedure and adjust the patient's bed to an accessible working height. So for implementation, first is identify the patient and greet her by her name. So, good afternoon, Ma'am. I'm Kari Magsino, I'm your nurse for today. So can you tell me your name and birthday?
I'm Cassandra Santos and my birthday is July 20.
Okay. So, today, I will bathe you using the Tepid sponge bath to reduce your body temperature. Is that alright?
Yes.
Okay. So, after identifying the patient, provide privacy and wash hands, wear gloves, and follow safety precaution if you had contact with any body fluids. So, in bathing the patient, first is cover the patient with blanket. And remove patient's gown. Keep the blanket cover the patient's body parts that are not being sponged. Next is to put bed protectors under the patient. After that, put 4 washcloth in water. And squeeze it to avoid it from dripping. Put 1 washcloth on patient's forehead. Each axilla. And 1 on her groin. After that, using 1 washcloth that is folded into a mitt, gently sponge the an extremity for about 5 minutes. Then proceed with the back and buttocks area. Continue doing this for about 20 to 30 minutes so it would be effective, and repeat it if necessary. Change the water. Change the water and reapply the washcloth on each axilla and groin. Using the remaining washcloth, dry the patient thoroughly. After that, cover the patient with light blanket, and as much as possible, do not allow the patient to wear heavy clothing. Help the patient return to safer help the patient return her back to a safer height, and remove gloves and wash hands. For evaluation, return equipment to storage, clean area, and change linen as necessary. Next is record time procedure was started, when ended, vital signs, and patient's response. This is to ensure proper documentation and communication among health team members.